Welcome to PHARMATIVE Live. I'm Dr. James Partyka. I'm a clinical pharmacist and an oncology research scientist and the founder of PHARMATIVE. PHARMATIVE is all about connecting people and patients to healthcare professionals and scientists in order to educate ourselves about your healthcare and your family's healthcare so that you can make informed decisions with your healthcare team members out there, your doctors, your nurses, and pharmacists. That's PHARMATIVE, and this is PHARMATIVE Live, coming to you live from Palm Springs, California. Today's topic is entitled Voting Blue for Your Health and Your Health Care. But before we begin today's topic, I'd like to give you a brief update from last week's PHARMATIVE Live on COVID-19 pandemic in the United States. That episode from last week is available on PHARMATIVE YouTube and is also available on pharmative.com. But to provide a brief update, since that last episode last week, it's important to remember that in the United States right now, approximately 99% of all COVID-19 cases are the Omicron variant. Okay, so as you recall from previous episodes on COVID-19, the original vaccines that were produced by Moderna, Pfizer, BioNTech, and J&J were for the original COVID-19 virus, okay? Now, since then, the virus has mutated, and the Omicron variant has over 40 mutations in the spike protein located on the outside of the virus, which is the target for the original vaccine. So because of those 40 mutations or more in the Omicron variant, the vaccines are not as good as they were for the original virus. Okay, does that make sense? So right now, the good news is in the next few days, as distribution is occurring right now throughout the United States, a new vaccine manufactured by Moderna for those that are 18 years or older, as well as the Pfizer BioNTech vaccine for those that are 12 years or older, are now available that are specifically targeting the Omicron variant, okay? So the new guidelines, which you can retrieve at cdc.gov, says that if you have received your shot 2 or 3 months or longer prior, you're a candidate for the new COVID-19 Omicron vaccine, okay? So for more information, go to cdc.gov, but you can also go to another website to determine where you can receive your new Omicron vaccine shot. You can go to vaccine.gov, that's vaccine.gov. And my understanding is right now, the new vaccine is available at CVS. Now, we're coming closer and closer to flu season, so it only makes sense to get your new Omicron COVID-19 vaccine shot and your flu shot at the same time, as they're both safe and effective at preventing COVID-19 disease and safe and effective to preventing your risk of developing flu. Now remember, vaccines in general and medicines in general are not 100% effective for everything all the time, right? But for the vast majority of the people that do get their vaccine shots, it will reduce your risk of getting these viral illnesses, okay? So that's the update on COVID-19. I hope that all makes sense to you. And now we're going to talk about voting blue for your health and healthcare. And now I know I have a lot of Republican friends out there, and I know that it's important to have good discussions, factual information, and it's okay to agree to disagree. But my position as well as the editor of PHARMATIVE, as the editor of our Pride Nation Online Plus Health magazine, which you can retrieve at pridenation.com, and as the producer of Proud TV, as well as Pride Nation Radio, we have decided with my team that we are endorsing all blue Democrat candidates for this year's election in November. Now, I'm not going to review all of the various individual local issues and state issues. That's beyond the scope of this episode, but it's also beyond the scope of my knowledge bases, right? But I would encourage everyone out there to look at those Democrat candidates as well as the Republican candidates and independent candidates and make your decision for yourself and cast your legal vote in November. Now, the remaining of Pharmative Live this episode, I'm going to give you the reasons why I believe that voting blue for all Democrat candidates makes sense for you and your family's health and health care. Okay? So this is coming purely from my viewpoint and my team of experts here at Pharmative and Pride Nation Radio. First and foremost, during the 2 years of the Biden administration, there has been an overwhelming expansion of affordable health care through Obamacare. I believe it's every citizen's rights to have access to affordable health care. And I, as a licensed healthcare professional, know, as well as a patient, know how expensive it is if you get admitted to a hospital or if you need access to expensive medications or expensive procedures to treat your diseases, okay? Every single human being and even animals need to have access to affordable health care. And under Democrat leadership, we have now Obamacare, and we now have an expansion of Obamacare that allows millions of people to have access to affordable health care. That's number one on my list, and those were all led by President Obama and now expanded by President Biden, okay? Number two, recently enacted and passed both by the Senate, the Congress, and signed by Biden, what is referred to as the Inflation Reduction Act. In that legislation is the laws that will reduce drug prices and will cap on an annual basis for those that are 65 and older on Medicare a maximum of $2,000 out-of-pocket expenses for healthcare, for medicine, okay, $2,000 maximum. Now, I, being a scientist and a healthcare professional in cancer, know that the bills, because cancer is oftentimes a chronic disease, the cost of the procedures, the tests, and the medicines and the chemotherapy and the new monoclonal antibodies and new biologic agents that we do have cost hundreds of thousands of dollars, you know, and that's something that if you're diagnosed with cancer, and if it's a life-threatening cancer and you have an advanced stage of disease, with your oncologist, you need to really, and your family members, discuss how much these things will cost. What are your financial obligations? Because a high percentage of people with advanced stage cancer actually go into bankruptcy because they can't pay their healthcare bills. So again, if you have an incurable disease, like say, for example, metastatic colorectal cancer, which is often more than the vast majority of times incurable disease, okay? Not 100%, but the vast majority of the time. You may want to decide to go on a more mild oral therapy and preserve the quality of life that you have rather than going on aggressive combination chemotherapy. Okay, that's just one example. Again, every time you make an example, it's generalized. You then have to bring it back to the individual with the disease, with the doctors, the pharmacists, and the nurses to make an informed decision, as well as a social worker that can help you or an administrator at the hospital determine what those healthcare costs are. But I think it's a huge win for people 65 and older to have their drug costs capped at $2,000 per year. That's another reason why I'm telling you to vote blue in November. Okay, we're very familiar right now with the U.S. Supreme Court's decision to overturn the precedent of Roe versus Wade, right? Which has now limited millions of women throughout the country of obtaining abortions. Some of them are for medical reasons, because the fetus is not viable, because it's threatening the mother's lives. There's many different reasons why women need to discuss with their doctors whether or not an abortion is appropriate, and with their family members, and with their priests and their rabbis, and with their ministers, of whether an abortion is right for them. But it shouldn't be up to the U.S. Supreme Court, which are mostly misogynistic, discriminating against minorities. They're mostly out of touch with middle class and lower classes of America, and they're out of touch with what the majority of American citizens want. They want women's reproductive rights. They want equality rights across the board. And they don't want the U.S. Supreme Court to be making laws from the bench. So again, another big reason, I'm going to touch a little bit more on this later on, about overturning the decision of the U.S. Supreme Court, because there's at least two ways we can do that. So stay tuned. The American Rescue Plan, which was passed right after President Biden took office, that provided $1.9 trillion not only to fight COVID-19 disease, to get vaccines in the arms of Americans, to get free COVID testing sent directly to your homes, but it also provided money relief for small businesses and to recharge the economy. That was huge. So when people talk about us having a recession, yes, we may be approaching recession, but most economists feel we're not currently right in a recession. But we are recovering from one of the largest viral pandemics we've had in this country since 100 years ago with the Spanish flu. So that's number one. Number two, I do feel that the infrastructure bill that was passed again under the Biden's administration, and again, it took both houses, the House being blue, the majority being Democrats, and the Senate, which is marginally blue because it's 50-50 in the Senate, and then we have the tiebreaker vote of the vice president, right? So it's a slim. But under a very slim margin in the Senate and in the House, President Biden has been able to legislate and enact laws. If we can enact laws, those are much more difficult to overturn in the future, because judges are not supposed to be legislating laws from the bench. Okay? So that's one way that we could fight what the U.S. Supreme Court has done recently with regards to overturning Roe versus Wade. We can enact legislation to embrace women's reproductive rights. Vote blue. Okay? The infrastructure bill, which is almost $1 trillion, which is going towards fixing our dilapidated bridges and roads, putting in the infrastructure for electric vehicles, putting in the infrastructure for people to have high-speed internet. Huge. That was a huge achievement done by this administration. The Inflation Reduction Act, which is a huge amount of money which is dedicated towards the reduction of CO2 emissions, which is part of the problem with global warming, which is a major problem with global warming. And we see that with the severe storms and flooding and the tide's rising. I think it's estimated that in the next couple of decades, I may be off by a number of decades, but by the end of the tides are going, the floods, because of the melting of the polar caps and Greenland and so forth, going to rise by about a foot. So we're going to lose a foot of beach, and the storms are going to get more and more severe. And almost every single scientist says global warming is a true phenomenon. We've got to get away from fossil fuels by providing the incentives to take those jobs to producing green jobs, jobs that will produce solar panels, wind turbines, electric vehicles, all of which is going to drastically cut down CO2 emissions. And not only is that good for improving our global and warming problems, but it's also great for reducing pollution and improving our health, because we're not going to be breathing in those the pollutants that are in the air. So again, the Inflation Reduction Act, huge. Improving health care for veterans, huge. Another major legislature that has been passed, taking care of our veterans' health, which is incredibly important. The CHIPS and Science Act, again, allowing us to be able to compete with China to make these electronic chips that power our electronic devices and cars competitive with China right here in the United States. That's huge. That's going to help jobs here in America. And when you're employed and when you have more disposable income, you can better take care of your health, because you can go see the doctor and pay for the doctor's visit, and you can go to your dentist, and you can pay for the medicines to take care of you and your family and your children. The other important piece of legislation was on gun violence, where they now provided a significant amount of money for funding mental illness. And that's something that, unfortunately, for decades, we have underfunded mental illness research. We have underfunded mental illness care. Okay, so this legislation provides funding for mental illness, but also requires background checks for adults that are 21 years or younger. Okay, common sense. Hopefully there will be more gun legislation. Everyone believes you're entitled to have a gun according to laws. But are you supposed to really have automatic weapons that are shooting people at malls and at events and so forth? Or children in schools? We need more gun legislature, but at least this is a step in the right direction. President Biden and Congress have also supported the Ukrainians in the Ukrainian-Russian war, which has ultimately strengthened our NATO alliance, and 2 countries are now entering NATO, and perhaps in the future Ukraine will be entering NATO as well. This is very important for peace, and I can't think of anything more destructive on anyone's health than war, bullets and bombs. Okay, so the Ukrainians are making progress, and hopefully the war will end soon. And hopefully, again, we can help the Ukrainians get back in rebuilding their country and providing healthcare services and additional services like food and resources that they need, medicine as well, to recover from the Ukrainian war. President Biden ended the Afghanistan war, which was a 2-decade war. Again, war kills people. It doesn't make sense to have an endless war in Afghanistan, but rather use humanitarian efforts to help the Afghan people. Again, I think that was a huge accomplishment. I was all for it. And I just want to acknowledge Helen out there, Jimmy out there, Alan out there, a number of friends out there. This is Pharmative Live. And we're now having a great discussion about why you should vote blue in November for improving your health care. One of the biggest things that Biden has done is he has created more jobs than any other president in the United States. When you create jobs, you create income for people to be able to spend money on their health and health care. And right now we have one of the lowest unemployment rates of 3.9%. In addition to that, President Biden opened up the United States gas reserves and worked with other countries to open up production of gasoline, and gasoline prices over the last few months have dramatically decreased. So, a lot of good things are happening in America under a blue Democrat House and Senate and President. Now, in order to continue to pass additional positive legislation, which will help you and your family members improve your health and health care, which would allow us to ensure women's health reproductive rights, as well as other minorities, as well as the LGBTQIA community equal rights. We need to keep both the House and the Senate in November. And that's why I'm making a very general statement: vote blue for all Democrats in November. It's not going to be easy to keep the House or the Senate, and some of these races are very close. And I think one of the most disturbing things are races like in Pennsylvania, where the race for the governor, the Republican candidate for that governor is going to elect a Secretary of State that will have the power to toss out your votes and opt for the candidate of their choosing. That is what President Biden means by autocracy and by fascism. Okay? He referred to in his speech last week, I think it was Thursday night, as we the people. Every citizen of America is entitled to one legitimate vote, and no one has the power to discount those legal votes. And that, unfortunately, is what in Republican red states are doing now, changing voting laws to make it more difficult to vote and giving the power to the secretaries of their states to throw the votes away if they don't like the outcome. That's not a democracy. That is moving towards an autocracy and fascism, okay? So let's just call a spade a spade. I try not to get too emotional on these matters, but it's a little challenging at times. I'm just saying what I see from my viewpoint, and I'm happy to rebut through my email as well as through the phone or a video conference call your viewpoints as well. And you can always contact me at info@pharmative.com. Every election race matters, and you as a citizen can get involved today by becoming more informed about the candidates that are running in your districts and state. And you can volunteer. And you can volunteer for those candidates of your choosing. And you can peacefully protest the recent actions of the U.S. Supreme Court, which overturned a precedent of Roe versus Wade, which was against what the American people, on vast majority, feel is wrongful. Now, there's another way, in addition to passing legislation to ensure that women have reproductive rights and that we can pass our own legislation. I mentioned that earlier. But number two, we can look at the U.S. Supreme Court and see that they're out of touch with the lower and middle classes of this country. And they're out of touch with what the American people think And we can expand the U.S. Supreme Court and add a number of judges under the Biden administration that are more representative of the American people in general. I'll just leave it at that. I won't talk about specific Supreme Court justices, okay? I'll just leave it at that. But there are two ways, again, that we can do this. One is by passing a law that protects women to make those decisions for themselves with their doctors and their family members. And there are extenuating circumstances, okay, of why a woman needs access to health care. And unfortunately, it's the poor people that can't travel to a state to get an abortion. And sometimes you don't even know if you're pregnant beyond 6 weeks, okay? And sometimes the pregnancy is ectopic pregnancy, or sometimes the fetus is not viable. So how can you legislate this? Okay? The only way you can legislate this is by giving the women the reproductive rights to make that decision with their doctors. Okay, I just want to remind you that our PrideNation.com online magazine, which includes Plus Health, has a feature article on Roe. It's entitled Roe Fell, Now What? And it goes over the organization Positive Women's Network, PWN, and their ability to mobilize and to continue the fight for women's reproductive rights. And in that article, they make a comparison to that of the HIV movement, where I, as a member of the Human Rights Task Force, have been actively involved with LGBTQIA rights. And those activist groups can get together to form an alliance for human rights for all American citizens. And that's what we need to do. We need to work together. We need to combine the organizations, the activist groups, to work together on our common interests of human equality, human rights for all Americans. So, with that being said, I strongly encourage you, again, to look at the candidates in your districts and states. And I say, hashtag vote blue, no matter what. Because a lot is depending on this election. Not only is health and healthcare dependent on this election, our freedom, our equality, rights are depending on these elections. Our democracy are dependent on these elections. So please, strongly consider voting for your blue Democrat candidate in your district, in your state, as I think it's best for all of us in general, and I think it's best for your health and healthcare as well. I'm Dr. James Partyka, and I'm telling you today to stay blue. Gotta take that out. Gonna have to edit this one. Stay healthy by voting blue, as it's easier to prevent disease than it is to treat it. That's all for today. I'll see you next week.